Lauren, in emergency medicine, it's about the cases. The cases are growing at 1 or 2%, it seems. What are the cases like? Who are the people getting the virus right now?
We're seeing a lot of cases of middle-aged Americans who have these comorbidities, but we're also seeing younger people as well. So I think the early data that we saw that this was all affecting the elderly with these comorbid populations is not necessarily true. We have a wide age range in our population. We have a lot of essential workers who have been working this whole time. We have a very large Hispanic population that we're serving at Hopkins right now, and I think that's true in many cities across the country.
I mean, it's fascinating here to see the idea that in certain geographies we're going back, and yeah, it's the younger people going back and all that. When you see younger people trying to get back to what we knew, do you feel like they're at a greater risk because they think the only one that gets the virus is 75 and over?
I think that early messaging about it only being the elderly didn't help. I think we saw young people resistant to social distancing, resistant to some of the other public health approaches that we use. And, you know, they exactly like you're saying, were still going out. They were still interacting socially. And I think we're seeing the effects of that resistance to adopting these measures. I think that's what we're seeing right now. I also think that these people are they are part of the essential workforce. So we're seeing healthcare workers. Across the country, we're seeing people from these meatpacking plants, from farms, from food processing centers, and they are younger folks as well.
Lauren, Sauer, talk to me a little bit about this Moderna vaccine. That then we had reports yesterday that it just didn't give us enough information to know whether it was going in the right direction. Are we going to have news flows like that more regularly?
It's not uncommon for these companies to put out press releases, but usually they have data attached to them. This report showed that the people in the study, 8 people that they had conducted the full review of, had neutralizing antibodies, which is good. So they basically saw that people in 4 of the different arms that they built developed neutralizing antibodies. The challenge with it only being 8 people is partially because it takes a long time to do the neutralizing antibody research. And we didn't hear from the other, I think it was 35 or 36 trial participants as to how they did or why they didn't develop neutralizing antibodies, or even if they didn't develop them. We need more time to understand those data. And so there's no way to know what these data mean. And so I think that's what we're all waiting for. We're waiting for that resulting data set to do that analysis, to know if the response is going to be durable, to know, what the rest of that vaccine population looks like. So I think we still have a ways to go. It was a surprisingly upbeat result, but I think it is definitely a positive finding. We just have to wait and see what happens next.
What do you make of what we've heard from the World Health Organization overall? So we had the Health Assembly. Who's in charge of briefing governments in this? Do you rely on the World Health Organization, or is it each country for their own?
Yeah, I think the World Health Organization is still our number one leading international body, serving all of these member states, and they are putting in place the structure by which this entire international response is happening. We did hear, it's a digital World Health Assembly. It's just a couple of days, so I think it's not going to be the same as it normally is. We did hear calls from the EU and Australia for an inquiry into the origins of the COVID-19 outbreak, which clearly seems to be directed at China, even though China wasn't specifically named. And I think that there remains some politicization around China's role in this outbreak response. So not even the origins, but how that early response occurred. And so I think we'll continue to see tensions around the assembly, but we have to continue to support the WHO and their role in global pandemic preparedness and response.